Blood-brain barrier, BBB. What is this concept? Is it any anatomical location in the brain, my dear students? Is blood-brain barrier is any anatomical location in the brain? The answer is no. No. Then what is it? Now the sentence is very important. Blood-brain barrier is constituted by the specialized arrangement of the brain capillaries. My point is very important. It is, blood-brain barrier is a specialized arrangement of the brain capillaries, where there are very small intercellular pores, and plus those intercellular pores are blocked by the investment of neuroglial cells. This makes the junction more tight. I would like to repeat my words. Blood-brain barrier is a specialized arrangement of brain capillaries, where the intercellular pore, the pore between the two cells, is very small. Plus, there is investment of the neuroglial cell above that, making the junction more tight, so that only specific substances should pass to the brain. This specialized arrangement of the brain capillaries is known as blood-brain barrier. The specialized arrangement of the brain capillaries is known as blood-brain barrier. This is the normal capillary. A very big intracellular pore is there. The many important substances can easily pass through it. This is the general capillary. But this is the brain capillary, where the junctions are tight. And there is again the investment of this neuroglial cell. That neuroglial cell makes the junction more tight. And this is the reason, my dear students, only lipid soluble substances can pass to the brain. Are you getting my point? Only lipid soluble substances can pass to the brain. No other substance will pass to the brain. Getting my first point? Now, the same barrier is also available in the spinal cord. We call it blood-CSF barrier. It is the extension of the same blood-brain barrier that is also present in the spinal cord. Got the concept of blood-CSF barrier? Third, these brain capillaries are loaded with some chemicals, enzymes. Those will degrade the chemicals also. I would like to give a very simple example. In the brain capillary, it is loaded with COMT. COMT. Just example I am giving. The brain capillaries are loaded with COMT. Catechol O-methyl transferase is the enzyme. What is the name? Catechol O-methyl transferase is the name of the enzyme. It is the enzyme, my dear students, which degrade adrenaline, which degrade noradrenaline, which degrade dopamine, so that the circulating blood dopamine, the circulating blood adrenaline, the circulating blood noradrenaline will not pass to the brain, should not pass to the brain. This is known as enzymatic barrier. It also have choline esterase. It will degrade acetylcholine. These enzymes are loaded on the wall of the capillaries, so that these chemicals also should not enter the brain. You may be thinking, sir, these are the neurotransmitters also, but they are generated in the brain itself. No outside neurotransmitter will enter it. And that's why do remember the famous words by Dr. Joshi. Blood-brain barrier separates the brain from the blood completely, so that the brain dopamine is totally different than blood dopamine. Even we are giving dopamine to raise the blood pressure of the patient in the ICU, no single molecule of dopamine passes to the brain. आपण ज्या वेळेला ब्लड प्रेशर वाढवण्याकरता बाहेरनं डोपामाइन देतो, त्यातलं कण सुद्धा मेंदूपर्यंत पोहोचत नाही. एक कण सुद्धा पोहोचत नाही, नाही तर हवॅक झालं असतं. इट्स अ हॅपी न्यूरो ट्रान्समिटर. हा 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 करायला लागला असं पेशंट. एव्हरीवन इज विथ मी. Blood brain barrier completely separates the brain, so far chemicals are concerned, so far the transport of the drugs is concerned. Only lipid soluble substances can pass to the brain, no other substance passes to the brain. Every student should note this point, and that's why I told you in Ayurveda Charak Samhita, Chikitsastan, Udmad and Apasmar will get only Ghrutas and Tailas. I don't know whether they know blood-brain barrier or not, but they must have some logical sense to define such thing. I think एवढं distinction सापडलं नसतं. All other chapters are having Gutika, Vatika and all that. But only these two chapters which are related to the brain are having only two diseases of brain are explained in Shastra. Subtypes are there. What are those? Unmad and Apasma. These are the only two chapters having Ghrutas and Tailas. But striking आहे रे, मला तर विशेष विचारच करतो मी. CTZ is the area in the brain which do not have blood-brain barrier. Are you with me? I am repeating. CTZ is the area in the brain which do not have blood-brain barrier. And that's why CTZ can be assessed by water-soluble drugs also. Are you with me? All other parts of the brain tissue can be assessed only by lipid-soluble substances. Only lipid-soluble substances can reach to the brain, except the area of CTZ. CTZ stands for chemoreceptor trigger zone. The word itself is self-explanatory. Chemoreceptor trigger zone, the zone which get triggered by chemicals. In very simple language, it is the area in the brain which can recognize the chemical change. And out of that, when it recognizes that chemical change, it acts as a vomiting center. It acts as a vomiting center and produces emesis. Nausea and vomiting, which you commonly seen as a side effect of many drugs, is due to the stimulation of this area. Now, I should tell you one very important thing. Suppose my patient is suffering from jaundice. His bilirubin levels are rising. Does this patient will have the nausea and vomiting? My patient's bilirubin is rising. Will the same patient have that nausea and vomiting? The answer is yes. My patient's kidney is not working well. My patient is a patient of renal failure. His urea and creatinine is rising. The same patient will have nausea and vomiting. Is it true or not? True. Am I right? My patient is a diabetic patient and his ketones level are rising. His ketones level are rising. My patient is developing ketoacidosis. My patient is developing ketoacidosis. तुझं कुठे आहे मास्क? प्लीज मास्क. मला मी घालू नाही शकत आहे, मला शूटिंग चालू आहे माझं. तुम्ही प्लीज बाकीच्यांनी प्लीज फॉलो करा. Now, my patient is a patient, diabetic patient. He is having ketoacidosis. Will the same patient have nausea and vomiting? Yes. The question is why? In all these three situations, why the patient is having nausea and vomiting? Because bilirubin is also chemical. Urea creatinine is also chemical. Ketones are also the chemicals. And all of these three are going to stimulate CTZ, chemoreceptor trigger zone. And that's why the patient will have nausea and vomiting. Are you with me? Yes. Not only for the drugs, but also for other chemicals, sensitivity to CTZ is there. Any chemical change in the blood is recognized by CTZ and it gets stimulated and produces nausea and vomiting. Hope so, all of you are getting my point. Am I right? Naturally, all of you will agree with me, in inflammation, the permeability of blood-brain barrier increases. The substances which generally cannot pass blood-brain barrier can pass blood-brain barrier. I would like to give you a practical example. Penicillin in general is having very less access to access to brain. It is less than 1% of the penicillin enters the brain. But when it is inflamed, that is in the case of meningitis, the entry of penicillin is more than 5%. That is 5 times of the normal. And that is sufficient to treat meningitis. But only when they are inflamed. This is the best example telling you that whenever inflammation is there in the meninges, the entry of the substance may increase. The best example is penicillin. Thank you.